My name is Amanda. I work with women who are trying to quit smoking, and I have some tips for you in case you're pregnant or thinking about having a baby. First thing is, keep trying to quit, or better yet, don't start smoking. It can cause premature birth, which can then increase the risk of your baby having developmental delays, problems with eyesight, breathing, and more. So don't give up. There are people like me who are here to support you, because I know what can happen if you don't quit. Your baby could be born 2 months early and weigh only 3 pounds. She could be in the NICU for almost a month, put in an incubator and fed through a feeding tube that goes through her nose down into her little stomach. I know that because I smoked while I was pregnant, and that's what happened to my little baby. I quit. You can too. For free help, call 1-800-QUIT-NOW.
A message from the U.S. Department of Health and Human Services and CDC.
Hello, and welcome to Healthy Living with Tobacco Free Allegheny. I'm Joyce Petro. Over the last 50 years, since the birth of the nation's first public health campaign against smoking, smoking rates have declined substantially, from about 43% in 1965 to about 18% today. It's clear that our public health efforts have been effective in reducing overall smoking rates. But the bad news is that more than 42.1 million American adults continue to smoke. And every day, nearly 3,000 adolescents under age 18 try cigarettes for the first time. Even more alarming, a recent government survey showed that youth e-cigarette use tripled from 2013 to 2014 and now exceeds teen cigarette smoking for the first time. E-cigarette use by teens has exploded. From 2013 to 2014, e-cigarette use rose from 4.5% to 13.4% among high school students, and from 1.1% to 3.9% among middle school students. The Centers for Disease Control and Prevention estimated that there were 2.4 million teenage e-cigarette users in 2014. These millions of smokers face serious health consequences, including cancer, lung disease, heart disease, and more. An estimated 8.6 million Americans suffer from a serious smoking-related illness. These health problems are expensive, too, especially for public insurance programs such as Medicare and Medicaid, and new research shows that the health care costs of smoking are higher than previously estimated. Earlier research estimated the costs to be $96 billion, or 7% of annual health care spending. But new research published in December 2014 in the American Journal of Preventive Medicine reported that in 2010, nearly 9% of healthcare spending each year in the U.S. could be attributed to cigarette smoking. This equals more than $170 billion per year, and public health insurance programs such as Medicare and Medicaid paid for the majority, 60% of those costs. A separate study published in the New England Journal of Medicine this year found that 17% of the deaths among smokers was the result of diseases that previously hadn't been linked to smoking. These include kidney failure, intestinal disease caused by a lack of blood flow, heart disease caused by high blood pressure, and increased risks of infection. These startling findings show that researchers have underestimated just how lethal cigarette smoking can be. They also serve as a reminder that despite sizable progress, smoking continues to be responsible for many diseases and for premature death for millions of Americans. Public awareness and dissemination of these findings will, ideally, lead to policy changes that help to prevent and reduce smoking, such as tobacco taxes, clean indoor air laws, and media campaigns. These continued efforts are necessary to eliminate tobacco's toll on our health and on health care spending. These new findings also should motivate healthcare professionals to work to prevent tobacco use among their patients and aggressively treat illnesses caused by smoking. There is hope. By increasing federal and state funding of comprehensive and effective smoking prevention and cessation programs, we can lessen the burden of smoking on our healthcare system and improve the health of millions of Americans. Today, on Healthy Living with Tobacco Free Allegheny, we'll talk about an organization that's charged with helping to change community norms regarding tobacco. Tobacco Free Allegheny is a nonprofit corporation and is part of a statewide tobacco control program supported by the Pennsylvania Department of Health. Tobacco Free Allegheny, or TFA, serves as a resource for the community and aims to make it uncommon to see, use, or be negatively affected by tobacco or tobacco smoke pollution. Joining us today is Cele Fichter DeSando from Addiction Medicine Services at Western Psychiatric Institute and Clinic of UPMC. Cele is a member of TFA's leadership team and will discuss TFA's efforts in tobacco control and prevention. Welcome, Cele, and thank you for being with us today.
Well, hello, Joyce. It's so nice to be here. Thank you for having me.
Could you tell us a little about Tobacco Free Allegheny, its history, and how it got started?
Well, TFA is one of 8 regional contractors funded by the Pennsylvania Department of Health through the Tobacco Settlement Fund and was established as a nonprofit corporation in 2002 by the Allegheny County Health Department. And what its job is to do is to administer and manage the comprehensive tobacco prevention and cessation program in Allegheny County. And the funds come from Act 77, which was established as a result of the class action suit that was filed by 46 states against the tobacco industry.
So that's known as the Master Settlement Agreement?
That's correct.
So what is the need for tobacco prevention and control programs?
Well, what we know is that 50 years ago, when the Surgeon General's first report came out about the consequences of smoking on our health, that our smoking rates have gone down from 43% to about 18% currently. And 8 million lives were saved by that report. So we know that prevention and control programs work, but we also know that we still have a number of people who were smoking. As I mentioned, the current smoking rate for adults is anywhere from 18 to 21%. Pennsylvania, it's about 21%. And in Allegheny County, our adult smoking rate is almost 22%. And so we do know that, as was mentioned earlier, that the consequences of smoking on our health and longevity are very severe. So if we can't help the folks who smoke to stop smoking, and if we can't prevent teens from starting, then we are really contributing to the health risks and mortality of a great many of our individuals.
You mentioned the current adult smoking rates. Are the smoking rates different for teens?
Yes, they are. And I'm sure the number of people who are listening may have seen recent headlines that showed that teen smoking rates have greatly declined. And they have fallen from about 12.7% in 2013 of high school students to about 9%. But these statistics are very misleading because what teens tend to do is they tend to use more than one tobacco product. So if we look at all tobacco product usage, there has not been any decline, and new products such as hookah and electronic cigarettes, that usage is increasing. So we have a lot to do with teens. We know how to prevent some things for them, but we haven't quite figured out how to keep them away from the allure of new products.
Why is it so important to prevent teens from smoking?
Well, one of the things that happens with all tobacco products is that they contain nicotine. And nicotine for the developing adolescent brain is something that will actually alter the brain, and starts with increasing nicotine receptors, and then it alters the reward pathway so that the adolescents who might normally be developing and learning to have pleasure from social interactions or activities or sports actually get their increased pleasure from the use of nicotine or maybe another substance that actually hijacks the reward pathway, so that adolescents really change and develop some other problems very quickly.
Is that mechanism the same for the use of marijuana?
It is something that is connected, and we have seen that the old term that folks used to use was gateway drug, and that there were certain drugs that we thought might predispose an adolescent to further drug use. And more what we understand now is once you alter that reward pathway and alter how the brain responds to an addictive substance, then you actually are predisposing them to other use, and they're not responding the same way that their brain would be if they had not developed those nicotine receptors so early.
Very interesting. We're going to take a break. We'll be right back with Cele Fichter DeSando from Addiction Medicine Services of Western Psychiatric Institute and Clinic of UPMC.
I'm Marlene, and I'm lucky. I have macular degeneration. That's when the blood vessels in your eyes leak, and you can see blind spots in front of you. Eventually, you can go blind. Smokers are a lot more likely to get macular degeneration, and I smoked. I'm lucky because there's a treatment for it. Every month, I sit in a chair with my eyes held open by a retractor. Then the doctor takes a needle and injects medicine right into my eyes. The first time the needle went in, it sounded like an egg cracking. Every time I feel that needle in my eyeball, I wonder why I ever put that cigarette in my mouth. My tip is, smoking wasn't worth going through all this. And I'm the lucky one.
Smoking can cause macular degeneration. You can quit. For free help, call 1-800-QUIT-NOW. A message from the Centers for Disease Control and Prevention.
Hi, my name's Shane. I thought it would be helpful to give you some tips to deal with life after you get a tracheotomy from smoking. Like, here's one. When you have a hole in your throat, don't face the shower head. Water can go right into your lungs, so swimming's pretty much out too. Also, when it comes to eating, cut all your food smaller than a dime. And if you drop your napkin, you should squat instead of bending over to get it, because you don't want the food in your stomach to come back up. Believe me, it happens. When you're working outside, keep your stoma covered. That's the hole in your neck. You don't want grass or anything else going into your lungs. And remember, in case of emergencies, CPR isn't mouth-to-mouth, it's mouth-to-stoma. Those are just a few quick tips. You'll learn as you go. I did.
Smoking causes immediate damage to your body. You can quit. For free help, call 1-800-QUIT-NOW. A message from the U.S. Department of Health and Human Services and CDC.
Welcome back to Healthy Living with Tobacco Free Allegheny. I'm Joyce Petro, and we're here with Cele Fichter DeSando from Addiction Medicine Services of Western Psychiatric Institute and Clinic of UPMC. And today we're talking about Tobacco Free Allegheny and its programs. Before the break, we were talking about the importance of preventing teens from smoking. Can you tell us more about that, Cele?
Well, one of the things I think that surprises a lot of people is that more than 90% of the current adult smokers started before the age of 18. And when we asked those adults, they told us that they thought that they might smoke for a year or two. They never thought they would be smoking for a lifetime. And if we ask adolescents who smoke how long they think they're going to be smoking, they'll say, I can quit whenever I want. This is something I'm just going to do for a little bit of time, partly because they don't understand the addictive nature of nicotine. And the thing why that's such a concern is if the smoking continues at the current rate among the young people in this country, that 5.6 million of today's Americans younger than 18 will die early from a smoking-related illness. So that's about 1 of every 13 Americans aged 17 years or younger who are alive today. And for all of the parents and teachers and those who are concerned about the future of this country, we really need to protect those teens. And so that's why Tobacco Free Allegheny really has as one of its charges to help prevent teens from smoking.
Can you tell us what kind of programs Tobacco Free Allegheny provides or supports to prevent teen tobacco use?
There are a number of different categories. The first is to support evidence-based prevention curriculum. There are several programs, but the PATHS program, which is promoting alternative thinking strategies, and the Life Skills program are two evidence-based curricula that TFA supports and actually helps to have service providers go into the schools to either teach those program or to help train the teachers so that that would be a sustainable program. And they have supported that by providing the curricula for those schools who cannot purchase those. So that's something that actually can go on beyond the life of any organization or any one person go into a school. The other thing that TFA did was help to develop a tobacco-free schools policy toolkit that is available at TFA's website and is available for any school or any individual who wants to download that toolkit to help a school improve their policy to keep the students protected from smoking and to provide comprehensive education and prevention. And then most of the schools have what's called a student assistance program. And TFA has helped with that program so that the teachers and counselors who work with that might be better able to identify students who are having trouble with smoking and then refer them to appropriate programs. In addition, TFA also works with a program called Young Lungs at Play. And this program is designed to help municipalities, parks, playgrounds, any area where children would be outside to keep those smoke-free. And they're helping to promote schools, daycares, the playgrounds, the parks, as I mentioned, to adopt the Young Lungs at Play policy that those areas will not have tobacco usage in them. In addition, TFA does compliance checks. That's designed to do is to ensure that retailers are not selling tobacco products to minors. And this is something that TFA has been very effective in helping supporting the retailers to understanding the law and understanding how they then can prevent teens from coming into their store and purchasing. In addition, TFA supports a youth advocacy program through the American Lung Association that's called TRUE. It's the Tobacco Resistance Unit. And when we mentioned earlier that we want to really help to have teens understand what tobacco does and how we really want to save those teens who are starting to smoke so that they're not part of a statistic, the Tobacco Resistance Unit, or TRUE, is a youth advocacy program and a leadership so that teens really start to take responsibility for their healthy living and to let the tobacco companies know that they're not going to be a statistic and they're not going to be a replacement for an adult who has quit.
So there's opportunities there for teens to participate in these groups and to assume some leadership roles and have some fun.
Yes, and they're actually doing some fun things with selfies, with hashtag I am not a replacement, and messages out there to the tobacco companies saying, we understand that you're marketing, but we can market for health too.
So we've talked about teens. What kind of programs does Tobacco Free Allegheny provide to help adults who are already smokers?
Well, on similar line as what is being done for youth, there are cessation services that TFA supports. And they support those through service providers who provide cessation, such as the Duquesne University Pharmacy Program, St. Clair Hospital, Pittsburgh Mercy Health System, who provide cessation services, but also in trying to promote the Pennsylvania Quit Line. The Pennsylvania Quit Line, which is a 1-800-QUIT-NOW, and it's something that I think a number of people know that it exists as a telephone support line for those who want to quit, but they might not understand what they can get from that quit line. So that an individual who calls that quit line not only will be encouraged to stop smoking, but will be given print materials to help them with that, and maybe to set up a quit date, but they also will be giving brief intervention counseling so that an individual will be able to receive 5 telephone sessions where the representative from the quit line will call the individual. But the person who has then enrolled in the quit line, they can call the quit line as many times as they want, their counselor for support or for more information, and they can actually also receive nicotine replacement therapy, and that's something that TFA helps to support. And so those are the cessation services that TFA does. But then how do we protect people from smoke and secondhand smoke? And so TFA also supports clean indoor air legislation and was very instrumental in the original Clean Indoor Air Act being passed here in Pennsylvania. And we know that one of the reasons why people smoke is because they can. So that if a workplace does not have a smoking policy where you cannot smoke on the job, more people will smoke and also expose others to the dangers of secondhand smoke. So by helping to promote policies where there are not exemptions for work sites and where work sites who want to develop a policy can learn how to do that, that's something that TFA does. And TFA also promotes lung cancer screening for individuals who may be at risk for developing lung cancer from their smoking.
Cele, you mentioned that Tobacco Free Allegheny provides cessation services in the county. Can you name some of the organizations that offer classes and where they can where people can call to find out about them?
Well, one of the ways is to go to Tobacco Free Allegheny's website, which is tobaccofreeallegheny.org, and folks can go to that website and there is a link for cessation services, and it will list all throughout the county what cessation services are available. In addition, if someone wants to call Tobacco Free Allegheny and call at 412-322-8321 and can ask and say, I live in this area, do you have something close to me? And then if it's something that's not listed on the website, the staff there will help. In addition, Duquesne University Pharmacy and St. Clair Hospital and Pittsburgh Mercy Health System, they are service providers for Tobacco Free Allegheny, and they have numerous programs throughout the area that would either be listed on TFA's website or the staff at TFA could help someone find that particular program. And maybe if there's not a class that's available right at this time, to get an individual hooked up with the PA, the toll-free quit line, so that people could actually get started talking with someone and to be able to start their cessation when they want to do that.
Okay, thank you. So how can other community organizations get involved in tobacco prevention and control?
Well, Tobacco Free Allegheny has a coalition that the coalition meets 3 to 4 times a year and there are community organizations, there are health organizations, legislative groups, church groups, those who work with youth, those who work with populations who are particularly at high risk. And they come together about 3 or 4 times a year and talk about policies and issues and new information around tobacco prevention and control. And anyone can join this coalition, and if you call a TFA or go to the website tobaccofreeallegheny.org, you're able to do that. So that's one thing. The coalition is very vibrant. One of the things that happens at the coalition meeting is we're always asking folks there, tell us about what you do. Tell us how we can get connected. How can we help you with how you're serving, whether that's children, people with asthma or diabetes, or adults who are in need, or folks who are living in housing and working on that particular issue, and how can we help each other to move forward with this. So, and along with that is that we try to support folks talking to their legislator. You know, if this is an issue that you feel strongly about or have learned something about, you want to talk to your legislator about removing the exemptions from the Clean Indoor Air Act. You want to talk to your legislator about making sure that we sustain the funding for prevention and tobacco control so that people are able to receive the cessation resources that they need, and we are able to support programs so that the teens do not start.
Well, what about individuals? How can individuals get involved?
Well, one of the things that we would like to talk to individuals about is everyone can talk to their legislator, and we would certainly promote that. And if you don't know who your legislator is, you can go to Tobacco Free Allegheny's website and find out. We're also asking anyone who was a smoker or a former smoker that you might want to talk to your primary care physician about what your risks may be for lung cancer, and finding out if you are a candidate for early lung cancer screening, so that you would then be able to make sure that you're taking control of your health. Maybe if you are a parent or you work with youth organizations, you'd like to become a youth advisor for TRUE, the Tobacco Resistance Unit, and you would be able then to help the teens actually become part of this solution, instead of being something that the tobacco companies want them to be the next smoker. We also are asking that you would support your school district, your municipality, in becoming a Young Lungs at Play site. If you would like to find out if yours already is, if you go to Tobacco Free Allegheny's website, there is an honor roll listed at that site, and you will see every organization and municipality that is participating in the Young Lungs at Play. And one of the things that we're asking folks to do is please talk to other folks that you know. Sometimes smokers don't realize that they can quit. They don't realize that there is nicotine replacement available for them. They don't know about the quit line. They don't know about these resources. So we're asking folks who have this information to please share it. One of the other things is that TFA does do education for retailers to help them to comply with the law about not selling to minors. There are training materials that are available. TFA wants to support every organization and every individual in helping to make sure that we are decreasing tobacco usage and making people safe from other folks' usage, and keeping both prevention and control. And so those materials, those services are available to the public. And again, you can call the office at 412-322-8321 or go to the website, which is tobaccofreeallegheny.org.
Cele, thank you very much for being here with us today. This is Cele Fichter DeSando from Addiction Medicine Services of Western Psychiatric Institute and Clinic of UPMC. Thanks for joining us today on Healthy Living with Tobacco Free Allegheny. You're invited to listen to this broadcast by visiting www.tobaccofreeallegheny.org.
I'm Nathan. My job gave me a lot. It gave me an income to support my family. It gave me purpose and pride. But the secondhand smoke there triggered my severe asthma attacks, infections, and lung damage. And I never smoked. It was so bad that my doctor told me I shouldn't work there anymore. I had to quit my job. But the damage was done. Now I'm so sick, I can't do much of anything I used to love to do. I don't referee youth basketball anymore. I don't run or lift weights. It's too much for my body to take. Instead, I'm taking breathing treatments or oxygen. I guess you could say my job gave me a lot. So let me give you a tip. Don't let people tell you that working around secondhand smoke is safe.
Smoking affects more than just your health. If you or someone you know wants free help to quit smoking, call 1-800-QUIT-NOW. A message from the U.S. Department of Health and Human Services and CDC.